in Metro Manila report that they are now at capacity or reaching full capacity for critical COVID-19 patients. Among them is the National Kidney and Transplant Institute in Quezon City. Let's go above and beyond the headlines with the hospital's Executive Director, Dr. Marie Rosete-Liquete. Good evening, Dr. Liquete. Thank you for taking our call.
Yes. Good evening, Pia. Thank you for this call.
Yes, ma'am. Well, talk to us, ma'am, about this. NKTI has reached the danger zone. You call it the danger zone in bed capacity for COVID-19 patients. My first question is, kailan po ninyo napansin na ganun na ang nangyayari? When did you first notice that this was happening?
Well, last week I expressed already my fear that we are in the danger zone. Well, according to our DOH, something like if you are more than 70% already of your designated bed capacity for COVID, then you are in the danger zone. Around last week, we're already like 89%. And now it's even more than that because our capacity actually has been filled up. Like we designated already more than 100 of our beds, 94 of our beds. And then in the emergency room, we have 47 beds, and they're full already. And just today, we got 11 more. 94 dedicated beds.
Okay, ma'am, 94 beds sa ICU. 94 beds sa ICU ang para sa COVID-19 patients. Tapos meron pa kayong 40 plus sa emergency room ng COVID-19.
47. Okay. And it's filled up already.
And then the other worrisome thing, Dr. Liquete, is that you have a significant infection rate among your healthcare workers. And you noticed, and this has been going on in the last 2 weeks. Pag sinabi po ninyong significant infection rate, so ilan po yon kumpara sa buong bilang ng inyong mga tao?
Well, it's like around 1.5% of the total, no? That's big enough because, it's like 4 a day. 4 a day, we have COVID positive in the past 2 weeks. So which means even if you quarantine each one of them, then we will be depleted actually. Like right now, we have like 40 plus of our healthcare workers not reporting anymore. And aside from that, we have increasing number of patients not COVID. So we may have to close another ward because we have no nurses to report. Yeah.
Okay. Ma'am, Dr. Liquete, my last question is that this announcement from NKTI, kasabay lang po ng announcement ng St. Luke's Medical Center, Global City, St. Luke's Quezon City, Makati Medical Center, Asian Hospital, all the big hospitals, well, I'm sorry, hindi naman lahat, no, but quite a number of big hospitals here in Metro Manila are making that announcement on the same day. This is quite worrisome.
Actually, since last week we had these fears already, and I'm also surprised that it's coincidental that all of us have together published this advisory. So it's really worrisome because we are the healthcare, and how can we take care of more COVID? And NKTI is a transplant center.
That's right.
You can just imagine if you are a transplant patient. I would also fear going to NKTI if we have lots of COVID. So I don't know how. I have expressed my fears already with our colleagues, and I hope they're going to help me also to decongest our dialysis patients. We have lots of dialysis patients here to start with, and then you add all these COVID patients, and those also refused by other hemodialysis centers. Some centers have closed because of this COVID and also other problems.
Yes.
So we are fully loaded.
Yes. Well, ma'am, I hope things... Yes. Yes, ma'am. I hope things do get better. Dr. Marie Rosete-Liquete of the NKTI, National Kidney and Transplant Institute in Quezon City. Ma'am, thank you very much for joining us this evening.